The process of that is irreversible and would also be accelerated if they are not properly stored. And to do this, we need to have systems that would carry them. Sorry, let me go back to the other presentation. We want to describe the requirement for correct ordering and delivery of vaccine storage, identify vaccine sensitive to heat and freezing, know how to manage breakdowns in the cold chain, and also to dispose of the damaged vaccine and who to inform when this happens. And also explain on how to audit correct management of cold chain within their practice areas. So those are some of the learning objectives that possibly we'd want to look at today. Sorry, my presentation is mixed up. And then the other thing is that we also want to look at the quality assurance. So we talked about the responsibilities. On the cold chain, one would want to ensure that there's somebody assigned to that, and somebody, of course, who has a deputy, somebody who is responsible, and somebody who has some skills in doing this. And the same person would possibly be checking on deliveries. He'd also possibly be checking on how the vaccines are stored. Like, for example, one would want to create a rotational stock, seeing that the old stocks are used and the new stocks possibly are kept at the back so that you're able to use the old stock first. And then, of course, somebody also need to maintain a register or some records for that purpose. And then, of course, also to maintain a supply and stockpiling, so that at no one time do you find that possibly you're overstocking, or you have a stock falling down to a critical stock that possibly might put you into some risks. So we talked about that. And that on that so we see the temperatures, that it should never exceed 8 degrees or fall below 2 degrees. But of course, others possibly might need to be frozen. Others possibly like would be in powder form. So they are a little bit comfortable outside without having to be in a fridge. And then, of course, as Dr. Kisi had said earlier, we had those records that were kept earlier, where the vaccines, somebody put a refrigerator. Somebody put. We used to have thermometers, dial thermometers, but in the morning when you come, you read what you want to read on the thermometer, because the thermometer will come and tell you, oh, it's is this degree on that particular time, but you are not able to see what had happened earlier, whether they were exposed, there was exposure, whether there was power outage for 8 hours, or whether the temperature also dropped down to minus 20 degrees. So as Dr. Kisha said, then I think we had elements of using vaccine that we were not sure of, whether they had been exposed or whether their efficacy was optimal. Then when you've done that, I think also in the village they would call the clinics, and people would come and with the animals and treat. And in the exercise, you could have some unwanted incidences where possibly there's a reaction. Like in public health, if there's an anaphylactic reaction, these need to be treated with a lot of caution, and the line manager or the in charge need to be informed for such unwanted incidences. So and I guess even in animal health, I think those would be the case. The other important thing is about disposal. As we said, they are biological, so we cannot just do the exercises of immunization, do very good cold chain, and then leave the waste or the clinical waste out there in the environment. And as you are all aware, we are living now in an area in times when there are a lot of issues on the environment, so we have to be ready to take care of the environment. So one is that we need to dispose properly. We need to dispose all reconstituted vaccines, dispose all opened single multi-dose vials, and also dispose all empty vials and ampules, and again also dispose all the syringes. And the element of sometimes thinking that because you've reconstituted one file and you've not used it, you want to take it back. That should not happen. You need to discard it. Once reconstituted, I think you need to throw it away. And most of the time, if you're in a setup where there's an incinerator, then the clinical waste need to be incinerated. If you don't have an incinerator, then of course you need to carry them to a center, to the other center, the tertiary center, where possibly you could be able to do that. And I think that's all about. And possibly I'd want to go through this, and then as we set up another, whatever.
Before he comes up here, he has mentioned clinical centers. I don't know, what is the equivalent of a clinical center in the veterinary setup? What do you think, Nyongeza? Let me go to Sabuni. Here he is. Are you the youngest now in this room?
Okay.
Yes. What is it?
A clinical center, I will equate.
Just talk.
A clinical center, I will equate that to the veterinary office, because that is where most of these activities and plans take place. Yes.
He's saying a clinical center is a veterinary office. Any other suggestion? Yes. Yeah? Vet clinics. Immunization clinical centers. What are those?
I think immunization, those are places like where communities gather, immunize the animal, or spray, or at the point where the cattle crashes.
Deal. Good. I think I put it clearly. When you are drawing your program, saying a certain date I'll be here, at another date I'll be here. Those are what we call the equivalent of a clinical centers. So when you say I have crashes in Uyapong, those are clinical centers. And that is why you bring in this idea of disposals. He will explain to you. So can you now put that one? When you talk about clinical centers are those areas. That's why you say, I'll spend in a certain area 2 days, especially in the ASAL areas. Because then maybe in a watering point, you will spend there 2 days. Kunder, because of the ASAL. Because animals come from this section 1 day. The next day is from this section. So that operating area there is the clinical center. And that is why through this project, Resilient was saying, keep the environment clean. And that is why he's going now to explain to us all this. Are you getting it? So it is what I want us to do in the public health, and what is there in veterinary or livestock should be going the same. Okay, it should be going the same. So that's what I wanted to stress. So others, Alex, coming.
Yeah, thank you very much. Yeah, Dr. Kisi has put it very nicely. That Munada place, that Karodi place is the clinical center. And I would want to say it's a sanitary center, isn't it? It's just like a health center, isn't it? Whereby you'd have a place to wash hands, isn't it? You'd have bathroom facility, isn't it? You know, going forward, we would want to have a toilet there. You'd want to have, because it's a clinical center, you'd have a shed where possibly, if you're developed, you could possibly put the vaccines. In the other areas, again, you'd possibly move with a tent, a rapid deployment tent, whereby you set the tent and you have the vaccines there, you have your ladder over there, you have the administrative work, somebody lighting, this kind of thing. And then, possibly even going forward, one would also want to imagine that we might not ask you to put an incinerator there, isn't it? Because it's very expensive, isn't it? But there's a way to do an incinerator, a simple incinerator, whereby you can build it like a kiln, isn't it? NEMA will not come to you and ask you, we want an incinerator that meets this and that standards. So if you have a kiln, a small kiln, which is lined with bricks, and where you can light some fire, you can be able to burn, the waste there, isn't it? So going forward, those are some of the things that possibly we'd want to see in those clinical setups. And disposal is actually very important. When you want to dispose, you have to really be very serious. Anytime that now you're doing any clinical things, somebody will come for you if you're not disposing properly. And then it's also important for you because when you dispose properly, you also protect yourself, isn't it? So we'd want to start with the PPE, the personal protection. And this I would say is a standard. Anytime that you want to do some of these clinical things. That cows come, you don't know what is there. You don't know whether you have anthrax, isn't it? Among the that you have there, that would come there, you don't know whether one would have anthrax, isn't it? So do you have proper personal protection? And the proper personal protection would mean that you have respiratory protection, you have eye protection, you have the full body PPE that is graded for biologicals, and splash and eye protection. So that is a state. That's a standard kit. And when you go to these clinics, you could possibly carry like 5 of these, and have them ready for for any eventuality that you don't know what you'd be dealing with, isn't it? The other thing is to be able to contain spillage. All right. Because, sometimes when it's blood, you'd possibly not be able to contain that. And sometimes it's very difficult to contain spillages. which, like TB sometimes can be in soil for a long, long, long time, isn't it? Even Rift Valley fever could be in the soil for, for many years. So it can come and affect us 5 years, 10 years. So any spillage from animals, from human, need to be contained. And in the hospitals now, they're using this spillage kit. And I'm sure people working in the laboratories also, you're using this now. And for you to be ISO certified, you have to have a spillage kit so that your lab is ISO certified. So again, even when you go to these clinics, the animal clinics, it's important to have a spillage kit. And basically what is here is chemicals, which help you to contain the spill. If there's a spillage of blood, you pour the chemical. It's actually chlorine-based. It solidifies very fast, and then you can be able to scoop that spillage, and then put it into now the incinerator that you've created, or possibly put it in a receptacle and come back with it. All right. So that's really very important. Before I go to that. We would also want to imagine that even when you go to the clinics, we've talked about anthrax, isn't it? And anthrax is a very big scare. Everywhere, globally, is a big scare, isn't it? Because it's like war of mass. It's very bad. It's worse than Ebola. It's actually worse than Ebola. If somebody want to finish us, anthrax would be, what is a very bad thing. So again, when you have those clinics, think about that. In a setup also, in a local setups, or even in a country, if there's an outbreak of Ebola or anthrax or whatever, again, you want to think, how would you decontaminate? How would you create decontamination? If you saw that cow and there was contamination, gross contamination, there's a lot of blood, how would you do that? So we're using Vicon, and I'm sure most of the veterinary doctors know about Vicon. It's a high-level disinfectant, which is used for those purposes. In this town, we keep 10 liters, always 10 liters for everybody. So if you have anthrax in Uganda and you call us,